Hi, friends. This is Dr. Ravi Kamapali. I'm an infectious disease wound care and obesity medicine doctor. I'm in Atlanta area, practicing at Regional Infectious Disease Infusion Center. Our website, nobadbugs.com, and our X handle at Wound Physician, and hashtag is removing barriers to healing. We're presenting three posters at Spring SAWC at Dallas, and this is first of the posters that we're doing a video recording on. And here we are presenting a continuous diffusion of oxygen therapy used in our office with a retrospective review in the context of patients who have been advised low-carb nutrition along with use of continuous diffusion of oxygen. And this is a retrospective review of the patients that was done. So wound healing is a complex physiological process that involves a lot of coordination that is needed, with oxygen and insulin playing critical roles in the process. So we need to know that these both influence the cellular and molecular mechanisms that facilitate repair, and we need adequate oxygen and also adequate nutritional energy for cellular repair and activity. And adequate oxygenation is needed for proliferation and collagen synthesis, and also keratinocyte and fibroblast function. Whereas from a nutritional standpoint, for glucose uptake, insulin is needed, but also in low-carb scenario, ketones are playing a major role in energy usage in wound healing. And of course, this insulin resistance problems are associated with reduced cellular responsiveness and energy availability issues. And there is a significant interplay between oxygen and insulin mechanics. And in such case, there is both oxygen deficiency and insulin resistance that contribute to delayed healing. And hyperglycemia, insulin resistance contribute to this major problem. And also, in this context, there is delayed healing, and hence we decided to try the new therapy that was available with continuous diffusion of oxygen. And then this study was done over from 2022 to March 2025 with using continuous diffusion of oxygen using oxygen system, which has been shown to have some effectiveness. And over this period, we had applied it to around 15 patients, and 2 patients had very short duration of CDO therapy. So only 13 patients were available. And basically, we did a retrospective review of these people, and 8 of the patients were diabetic, and 8 of the patients were non-diabetic, 5 were diabetic. And particularly, this therapy was applied in low-carb scenario, where patients were educated every time on every visit on low-carb nutrition and also high-protein nutrition. And we did a retrospective review. Here we have 3 cases, but there are a few recordings of the videos on this QR code. Please see this, and also poster is available on this QR code. And here we have a 91-year-old male who presented 1 day after injury with a skin avulsion. And basically, within 10 days of therapy, there is 76% closure. And over time, within 4 to 5 weeks, it went on to heal. And this is the second patient we have here, where a 75-year-old female who had diabetic foot ulcer with peripheral vascular disease, significant foot abscess with peripheral vascular disease that was corrected with the angioplasty. And we did try initially wound vac therapy that caused some dryness. Then we ended up stopping it, and essentially you can see the tendon exposure. And over time, we did hydrogel and sequential debridements. And then I started also using topical continuous diffusion of oxygen, and decided to use placental skin substitute graft with CDO therapy together. And this, by the time of this poster presentation, there was significant improvement. And even by the time of this recording, the ulcer is remarkably even better than this one. So over time, continuous diffusion of oxygen therapy contributed to the healing. And this is another patient with a 41-year-old African-American male with crush injury after a 300-pound steel fell on his foot. And Basically, I had problem with a first toe that has become gangrenous, and also there is a dislocation of the second PIP joint. And obviously, he did have metabolic syndrome problems with significant issues with hypertension also that were identified. And essentially, we did immediately start the patient on IV antibiotic therapy and did treat him with active local wound care, and ended up having to go back to surgery with once the stabilization was done, we were able to salvage the rest of the toe area here. So please review the further recordings of these few cases that we have on this QR code and the poster here. And as you can see that our results are reflecting what is cited in the peer-reviewed literature, and the significant improvement using CDO therapy is noted. And oxygen and insulin forms an integral part of a wound healing environment. And CDO therapy is a simple, very easy to use application on the top of moist wound healing, and helps with connection as the oxygen cannula generates this continuous diffusion of oxygen, providing humid oxygen at a very low flow rate that diffuses into the tissue, and optimized oxygenation and blood glucose regulation with optimized insulin sensitizing strategies with low-carb nutrition helps with wound healing with increased protein intake and supplementation of protein on bone broth, and all those effective nutritional interventions were educated to the patient. And obviously, there is a positive wound healing with this approach. So this is just a retrospective review of the cases that we saw. And obviously, this reflects what has been evaluated by different other organizations that have done it. And what we found in our experience is that this significantly aids in wound healing and accelerates the process. And also, it is easy to use and encourages patient compliance. Please review the poster and video recordings, and thank you for listening in. Thank you.